A free two-day clinic this weekend offers people from across the Mid-South a chance to receive dental care at no cost to them. Hundreds will line up to visit the annual Mid-South Mission of Mercy, and this year the goal is to treat 2,000 patients. For more on how that you can take part in this, we are live with one of the organizers, Dr. Stuart Hudsmith. Thanks for coming in this morning.
Thanks, Kanji, for having me.
Okay, so we're just days away from the clinic. Talk to me about how patients can sign up and who is welcome.
Well, Kanji, first off, everyone that has a dental problem is welcome. You don't have to sign up. Usually our patients will come out Thursday night. They'll start lining up about midnight, between midnight and 3 a.m. And you'll see a line form there of somewhere around 1,000 people. We've learned how to manage that line considerably better than we did in the beginning. We don't check green cards. We don't check name, ID. We don't care. We're there to spread joy and give back to the community and make sure that if you have a dental problem, that it's taken care of.
I mean, this clearly, anybody lining up in the middle of the night expresses what's really happening in people's homes. Can you explain just the magnitude of how you're helping people before and after?
Well, one thing that we see, and you, as you well know with your beautiful smile, the eyes, they say the eyes are the windows to the soul. Well, I will tell you that the smile is a measure of either joy or burden in one's life. And our goal here, because these people are underserved, they've either been a subject of neglect, possibly chemical abuse, possibly trauma, it doesn't really matter. We want to restore the confidence in their smile so when they go for that job interview, when they're taking pictures with their family, when they're out with their friends, that they can smile and show the joy in their heart.
And you, I mean, we've seen pictures that you've shared where someone might literally have no smile and then they leave and they actually have a full set of teeth. Can you talk also about the layout when people come in, what they can expect?
Well, first, Kanji, when our patients come in, we have the great people of Bellevue Baptist Church taking care of them as a person first. And they make sure that they're warm, they're cared for, they're interviewed. We decide what they're there for, whether it's an extraction, a filling, or a cleaning. We get them into a system where they will be medically triaged. Some of these people are sick. You know, they have blood pressure issues, they have diabetic issues, and we make sure that they're well taken care of before we do some kind of dental surgery on them.
Okay.
And so they're really managed from the moment that they get there until the moment that they are dismissed.
Are they limited to specific procedures?
You know, we have about 200 dentists, hygienists, and assistants there volunteering, and we do our very best to make sure that every single patient is taken care of with their specific need.
Right.
And some are very emergent. You know, some are infected, some have abscesses, some have are in need of extractions. Others are in need of cosmetic issues that we need to take care of so that we can restore their confidence and make them enjoy their smile in their community.
Okay, and so people can come out, and can you just talk about the hours really fast?
Well, our volunteers are very dedicated. They're going to start, they'll be there, actually we'll be there setting up on Thursday.
Wow.
It takes a lot, as you might well understand, to set this clinic up. We'll have about 200 operatories in Bellevue's facilities, along with all the things that it takes to make a dental practice. So they can show up anytime. You know, Thursday, if they're there before, you know, say 3 a.m. in the morning, chances of them getting in line and getting seen are very, very good. we can't stretch our volunteers past their limits, and so there are times when we do cut off the lines.
All right. Thank you so much, Dr. Stewart Hud-Smith, for being here and for what you're doing.
Kanji, thanks for having me.
Okay. An assistant